Hey, if you don't make it through the next 5 years, you might miss the biggest medical breakthrough in history. I know that sounds like a stretch, but I've been a doctor for almost 25 years, and I've never seen anything like what's happened in medicine over the last 3 years. The medicine that took care of your parents, your grandparents, and even the stuff I learned in medical school isn't the same anymore. Recently, some news caught my attention. Researchers at the Mayo Clinic published a study about an AI called RedMod. They took abdominal CT scans that looked normal. These were from people who had the scan for some other reason, a stomach ache, a suspected kidney stone, a routine checkup. The radiologist looked at the images, didn't see any cancer, and the report came back normal. But later, some of these people ended up developing pancreatic cancer. When researchers ran those same scans through artificial intelligence, the AI spotted signs of cancer before the official diagnosis, on average more than a year earlier. In some cases, even 3 years earlier. 3 years. Think about how big this is. 3 years can be the difference between, sorry, it's too late to operate, and, come on in, we caught it early. 3 years can be the difference between making a will and having a surgery that saves your life. And here's what keeps me up at night. Artificial intelligence is coming. Gene therapy is coming. Life-saving medicine is coming. But a lot of people won't make it to that point. Not because medicine failed, but because they died just before. Today I'm going to show you the most amazing breakthroughs in new medicine, in the heart, cancer, DNA, and at the end, I'll show you something you might have seen in the mirror without even realizing it. This video isn't here to scare you. It's here to give you time, because in new medicine, time became treatment. Medicine has had 3 big eras. Medicine 1.0, which lasted thousands of years, was all about observation. The doctor would look, feel, listen, smell, and do their best to guess. There were no antibiotics, no CT scans, no EKGs, nothing like that. There was no ICU. It was trial and error. Sometimes you got it right, but often you didn't. Then came Medicine 2.0. That's modern medicine. Antibiotics, vaccines, safe surgeries, cardiac catheterization, stents, statins, CT scans, MRIs, ICUs. It was an incredible revolution. It saved millions, maybe billions of lives, but it has a flaw. It's great for emergencies, but it still arrives too late for the diseases that kill the most today. Those diseases don't just pop up out of nowhere. They develop quietly, in the shadows, over years, even decades. A heart attack that kills at 60 often started when you were 35. Diabetes that shows up at 55 actually began much earlier with insulin resistance. And modern medicine usually only steps in once symptoms appear. That's where Medicine 3.0 comes in. Medicine 3.0 doesn't just ask what illness you have now. It asks what illness you don't have yet, but are headed towards. It's preventive, personalized, data-driven, focused on living longer and truly healthy, not just surviving. And now, with artificial intelligence, sensors, genetic alarms, smartwatches, and predictive models, this medicine stopped being just theory. It's starting to arrive, and it's hitting my world first. The heart. For decades, the heart basically had to scream at us before we noticed something was wrong. Chest pain, shortness of breath, palpitations, high blood pressure, fainting, fatigue that just won't go away. But the heart is sneaky. Often it gives no warning. Someone feels fine, gets a regular checkup, and then one day they have a heart attack. And then what? You know that phrase every cardiologist has heard? But doctor, he had tests and everything was fine. The thing is, in Medicine 2.0, everything's fine often just means I don't see anything serious yet. But Medicine 3.0 started to spot what used to be invisible. Not long ago, when you had a coronary CT scan, doctors basically looked for calcium, major blockages, serious narrowings. The question was, is the artery already clogged? But researchers at Oxford, backed by the British Heart Foundation, started focusing on something something else: inflammation around the arteries. And this is fascinating because inflammation can be a risk marker. It can show that a plaque is unstable. That artery, even if it doesn't seem that serious right now, might be gearing up to cause problems soon. Using AI with heart CT scans, these models started predicting future cardiovascular risk with a level of accuracy that old-school medicine just didn't have. 10 years. Think about this with me. You get a CT scan today at 52. An AI looks at it and says, you're on track for a heart event at 62. That's huge. That's a whole decade to change the game. 10 years to lower your LDL, control your blood pressure, lose visceral fat, sleep better, work out, eat more oats, adjust your meds, quit smoking, change your fate. And that's just the warm-up. If predicting a heart attack already blew your mind, wait until you see what it can do with cancer. It'll leave you speechless. Now, go back with me to the start of the video. Pancreatic cancer, red mod from the Mayo Clinic, up to 3 years before diagnosis. Why is this so important? Because cancer has a main weapon. It's not just about being aggressive or fast or spreading quickly. Cancer's main weapon is silence. It plays dirty, growing in the dark, without pain, without fever, no warning, and something just silently grows inside. When the first symptom shows up, pain, bleeding, a lump, unexplained weight loss, a lot of times the game is already too far gone, and that's always been the tragedy of Medicine 2.0. Medicine 2.0 chases after the tumor when it's already the size of a marble or a lemon, or when it's already sent cells to another organ. But Medicine 3.0 decided to do something different. It decided to turn on the lights in the room. Pancreatic cancer is one of the worst diagnoses in medicine. Most of the time, it's found way too late. Why? Because it usually doesn't give any warning early on. No alarm sounds. Sometimes there's a vague pain, some weight loss, yellowish skin, weird digestion, and by the time it finally shows up on the scan, it's often already past the ideal stage. But Mayo trained AI to see texture, patterns, tiny changes, mathematical clues hidden in the image, things that don't shout out to the human eye, but quietly whisper to the machine. And I want to be clear here, this isn't against radiologists. I have a lot of radiologist friends who are great at what they do. Human radiologists have limits. The human eye has limits. Machines don't get tired, don't blink, don't get distracted. And Medicine 3.0 is learning to listen to that whisper. This changes everything, because 3 years could be the difference between no more surgery possible and we caught it early, you're cured. And maybe the next big leap won't even need a CT scan. Maybe just a needle. For decades, tracking cancer was like searching for multiple needles in lots of different haystacks. Mammograms for breast cancer, colonoscopies for the gut, pap smears for cervical cancer. Lung CT scans are still essential for certain high-risk groups. Don't dismiss them. But now there's a new frontier: blood tests that can detect multiple cancers early. The idea is simple and powerful. Even a tiny tumor can release tiny bits of DNA into your bloodstream. It's like the tumor leaves genetic crumbs floating around in your veins. Medicine 3.0 has started looking for those crumbs. Just one blood test, one sample, one shot at catching it early. Tracking signs of dozens of types of cancer at once. That's huge. But heads up, real medicine doesn't promise miracles. These tests still need to be used carefully. They can give false positives, cause anxiety, and lead to unnecessary investigations. The big question remains: does finding cancer earlier actually lower death rates? But the trend is clear. We're moving away from the days when cancer had to make noise to be found, and into an era where medicine tries to catch cancer while it's still whispering. If that already sounds impressive, now comes the best part, because up until now, I've shown you Medicine 3.0 predicting things. But the big promise isn't just to predict, it's to cure. To explain this leap, I need to introduce you to a woman, Victoria Gray, from Mississippi, USA, a hardworking mom who was diagnosed with sickle cell anemia as a baby. Sickle cell anemia is a harsh genetic disease. The red blood cells, which should be flexible, get misshapen into a sickle shape. They clog up tiny blood vessels. She suffered from crazy pain crises, hospital stays, blood transfusions, organ damage, fear, exhaustion, a life put on pause. Victoria lived like this for decades. In 2019, she joined a clinical trial in Nashville and became one of the first sickle cell patients treated with CRISPR. CRISPR, simply put, is a gene editing tool. A lot of people call it molecular scissors. It lets you find a specific spot in the DNA and change a biological instruction. It's like medicine opening up the cell's instruction manual, defective, and said, "This gene is causing the disease, let's change the code." In December 2023, the FDA approved Casgevy for sickle cell anemia. It was the first therapy approved using CRISPR. Just think about how huge that is. For centuries, medicine dealt with the aftermath: pain, morphine, kidney crisis, hospital stays, infections, antibiotics, clogged arteries, putting in stents. But now the question changes. It's not just about easing symptoms, it's about fixing the very code that causes the problem. This is Medicine 3.0 in its purest form. It's not just about treating the symptom, it's about tackling the root cause. And now you might be thinking, okay, doc, but this is a rare disease. What does that have to do with me? It has everything to do with you because now I'm going to bring it into my world, the heart, cholesterol. For over 20 years as a cardiologist, I've seen the same scene thousands of times. Patients with high LDL, risk of heart attack, heavy family history, plaque in the coronary arteries, in the carotid artery, afraid to take medicine. Or they take it for a while, improve, stop, then their cholesterol goes back up. So we adjust the dose, change the medicine, add another one. You have to keep retaking tests. And for a lot of people, this goes on for decades. But there's a new line of research trying to change that. Verve Therapeutics has developed gene editing therapies targeting the PCSK9 gene in the liver. PCSK9 plays a role in cholesterol metabolism. When this system messes with clearing out LDL, the bad cholesterol builds up, keeps circulating, gets into artery walls, feeds plaques, causes inflammation, leads to atherosclerosis, and eventually a heart attack or stroke. Now, imagine a therapy that goes into the liver and lowers it permanently for the rest of your life. The activity of a gene that messes with this cleanup. It's not a pill a day. It's an attempt to change the risk right at the source. Sure, it's still early. Still experimental, still needs to prove long-term safety, and it's not something you'll see in the doctor's office tomorrow morning. But the concept is real and already being tested. And for cardiology, this is a game changer. Because maybe in the future, high-risk patients won't have to spend their whole lives trying to push their LDL down. Maybe medicine will be able to reprogram the system that keeps that LDL high. It's like a heart attack vaccine is starting to appear on the horizon. Still far off, but now you can actually see it. And speaking of vaccines, the same mRNA technology that everyone got to know during the COVID pandemic has opened up a new path, cancer vaccines. But not some one-size-fits-all shot. It's personalized, made from the unique makeup of that patient's tumor. The doctor studies the cancer, spots specific mutations, and creates a vaccine to train the immune system to recognize that particular enemy. It's like giving your immune system a mugshot of the criminal. Look out for this cell, recognize this signature, attack if it comes back. In high-risk melanoma, studies using a personalized mRNA vaccine combined with immunotherapy have shown a significant drop in the risk of relapse or even death. That doesn't mean the cancer is gone, and it doesn't mean every tumor will have a vaccine tomorrow, but it does mean medicine is stepping into new territory. Instead of just bombarding the tumor from the outside, like chemotherapy, radiation therapy. It's when medicine starts training the body itself to hunt down the tumor from the inside, to predict earlier, spot it earlier, act sooner, and, when possible, reprogram the biology. Now, I want to show you something you might not have noticed. Maybe you've seen Medicine 3.0 written on your bathroom mirror, maybe even right here on this channel, and maybe even on your own ear. Remember that video where I talked about Frank's sign? That little diagonal crease on the earlobe, a line that cuts across the ear like this, on the diagonal. That video went viral. Almost 15 million people watched it. You know when I really realized the impact of that video? Last year, I went on vacation to the Northeast. I was just chatting in the hotel when the manager came up to me and said, "Doctor, you don't know me, but you saved my life." I stopped right there. He pointed to his ear and said, "See this?" It was Frank's sign, That diagonal fold on the earlobe. He went on, I saw a video of yours, decided to look into it, went to Recife, saw the first cardiologist, and he said it was nonsense, nothing to worry about, I was only 50. Then I went to another doctor and ended up getting 2 stents because of that video. 2 stents. An artery 95% blocked because of a fold in the ear. Now listen up. Frank's sign doesn't mean you're having a heart attack tomorrow. It's not a diagnosis, not a sentence, not a reason to panic. But it's a perfect example of the logic behind medicine 3.0, because a mark, apparently a little bump on the ear, might be a sign to pay closer attention to your heart. And that's the game changer. Medicine 2.0 looks at that ear and asks, is this just a wrinkle? Medicine 3.0 asks, what is this tiny sign trying to tell me about the future of this body? The difference now is that artificial intelligence is learning to connect all those signs that doctors used to see separately. AI starts to see the whole picture, the pattern. And then it asks the most important question. Where are you headed? That's the real question. It's not just, are my test results normal, but where is my body headed? So your part in this story is simple, but not easy. At 100 years old, all you have to do is not die. Make it through this decade. Take care of your sleep today. Keep your blood pressure in check today. Manage your cholesterol today. Monitor your blood sugar today. Work out your body today. Build muscle today. Be stubborn about your health because the extra time you gain now might be exactly what you need to see Medicine 3.0 cure what seems impossible today. At your next appointment, don't just settle for everything's normal, because normal isn't great. Normal isn't personalized. Normal isn't predictive. Ask, Doc, is my risk actually good or just within normal range? Is my LDL truly ideal for me or just below the limit? Is my blood pressure really under control? Is my blood sugar excellent or am I just not diabetic yet? My weight, strength, waist, are they taking me where I want to go? That's the question of Medicine 3.0. Where am I headed? Don't wait for symptoms, because symptoms are often like the alarm going off after the fire has already started. You can't die before your time. You can't die before your time. And if this video touched you, do me one favor. Don't just like it or subscribe, that's up to you. I want to ask something more important. Send this video to someone you want to see alive in 2035. Your dad, your mom, your husband, your wife, your kid, your brother, that friend who only goes to the doctor when they're already hurting, that person who says, I'll check it out later. Send them a simple message. Watch this. It's about us, about our future. Because this video isn't just about technology, it's about time. And time is the only thing we can't buy back. Now tell me down below, which of these leaps surprised you the most? Or the fact that even a fold in your ear could be a sign to take a closer look at your heart? Watch this video here. It's got over 14 million views. I'm Andre Wambier, a cardiologist. Check out the channel at cardiodf.com.br. This medicine is coming, but you're the one who needs to reach it. See you in the next video.